411 coming up on 412 here on KHTS. I am very excited, very happy to be bringing in Dr. Megan LeCornu back to the studio. It has been far too long. What has it been, 2 weeks?
Yeah, right?
It's
that
too
might
long.
be the closest, like the shortest amount of time we've gone.
I know.
Right?
I know. It's usually a couple months, but look
Usually.
at us. We're pretty consistent now.
I know.
My long-lost friend, Dr. Megan LeCornu, Embrace Your Smile Orthodontics, Santa Clarita's #1 orthodontics office for the past 10 years, and I'm sure it's going to be 11 pretty soon.
Let's hope so.
And fellow Harvard alumni, Dr.
Yes.
Megan LeCornu. While you were going to the School of Dentistry, I was mopping the floors.
Oh, man.
Were you pre-Zuckerberg? Were you post-Zuckerberg? Did you guys overlap in time?
I was post-Zuckerberg.
You were?
Yep. So it was interesting, though. I did get to see the dormitory. Like, I knew the dormitory he was at.
Really?
And it's really interesting. Harvard, for the dental school, we have these societies. So I always joke with my young patients. I'm like, it's like Harry Potter.
Is
How
it
you
really?
have houses? Yeah.
Was it a culture shock to go to Harvard? Because I'm sure, this is the most elite school in the nation. Everybody comes from different backgrounds, but everybody is certainly of the highest intelligence. Was it a bit of a culture shock because you began at University of Denver?
Yep.
And then made the transition to Harvard? What was that like?
Yeah, so, it was very interesting. I think, honestly, the biggest thing for me was I grew up in Colorado, so going from kind of this Midwest kind of center of the country feel to the East Coast. The East Coast is very fast-paced, it's just a different environment, and people there, I think, because of maybe there's less sunshine in the winter. I don't know. They're not as like smiley and open, but once you kind of break through that, they are some of the most loyal friends I have. All my friends from the East Coast.
Well, at least you didn't have to buy any winter coats, right?
I actually did. The
did?
winters in Colorado are very mild. Like,
Are they?
Did you know Colorado has like 300 days of sunshine a year?
Is that right? Is that right?
Yeah, it's kind of like California almost.
Yeah.
But
where do you go to snowboard? Do you snowboard still out here?
I go to Mammoth. I
Okay.
love Mammoth. I'm a little bit of a mountain, I have high expectations for mountains growing up in Colorado. Love Breckenridge and Vail and all those places. So in California, I'm kind of partial to Mammoth and Tahoe.
Right.
I've gotten to a few others.
It's worth the drive, is it not?
Yeah, I like powdery snow, so
Right.
yeah.
I hear you. I haven't been snowboarding in, I'm probably 10 years.
Well, this season is not the season in California.
Why is that?
We don't really have great snow this season.
Oh.
So, but Colorado has great snow, so.
Do you go back there to snowboard and
I am.
ski?
I'm going in 2 weeks, next weekend.
Are you a skier or a snowboarder?
I'm a snowboarder, yeah.
You're an urchin, according to Johnny Tsunami terms. So, had it not been Harvard, what was the fallback school?
So I was accepted to a few programs, and so I probably would have been UCLA or
Dr. Gilbertson's alum.
Yep, UCLA. So that would have been close by, which would have been nice. I also was accepted to University of North Carolina, which is actually where I ended up going for residency because they have the top orthodontic program in the country. So I probably would have gone to University of North Carolina for dental school because their dental school is also very excellent.
Was it always the mission to do residency at with orthodontics, or because you look around, and you're like, look, anybody could be a dentist.
Yeah.
Not everybody can be an orthodontic or orthodontist.
I knew I wanted to specialize, and that was actually one of the reasons when I got into Harvard, I really wanted to go there because at their program, about 98% of the dental school class specializes, where normal dental schools, the average is only about 10 to 15%. So it's a program that really focuses on producing specialists, and they kind of allow you to start learning about the different specialties and working in those different specialties from that perspective while you are in dental school. I actually thought I was going to be an oral surgeon. So when I went to dental school, I just was certain I was going to go into oral surgery. I loved surgery. And then what happened is we went to some craniofacial conferences. And in those conferences, that's where you have patients with like cleft lip, cleft palate, or severe dental facial discrepancies. Mm-hmm. And those cases are absolutely life-changing and so rewarding. And I was sitting in there at these conferences, and I realized the orthodontist actually acts as the engineer. And they're the engineer kind of designing the treatment plan for these patients, like how things are going to end up. So if we extract teeth, it's going to be one look. If we don't extract teeth, it's another look. How do we do the rubber bands to make a whole nother look? So all of these things are taken into consideration for the planning, and that's the orthodontic treatment. Then the oral surgeons are kind of like the contractors. They go in and do the big movements. They do that big surgical treatment. And then the patient heals for about 6 weeks, and then the orthodontists finish it. So once I realized the orthodontists were the engineers, I was like, that's what I want to do. I want to design the smile.
You guys do offer surgical orthodontics?
We do.
At Embrace Your Smile. Who does the surgery?
So we work a lot with Dr. Maurer and Dr. Coletta in town. We also work with Dr. Lang's office. And then also we work with some oral surgeons in other areas. So we have an oral surgeon we like to work with in Beverly Hills and another oral surgeon that's actually in Santa Barbara.
So I saw the headline, surgical orthodontics, and I'm a layman. I don't know anything. I was thinking, is this the dental equivalent of plastic surgery where you have a messed up grill, you go in, one sitting, and then you're done? But you're saying it's more detailed than that.
It is. So, when we have a orthognathic case, so it's called orthognathic surgery, usually those patients have a very severe jaw discrepancy that can affect their temporomandibular joints. It affects their speech, can affect how they're functioning. And so it's not just aesthetic, it's actually very much so functional and for the long-term health of their bite and their jaws. But what's really great is the side effect of that surgery to get a good functional outcome is a very nice aesthetic result. The other thing that we're seeing a lot of is patients with sleep apnea. So there's a lot of patients that have sleep apnea and issues like that, and oftentimes they are also very good candidates for a surgical approach so that they don't have to live their lives on a CPAP machine.
Right. Before we got on air, you were mentioning to me about how you're seeing a lot of thumb sucking. A lot of thumb sucking is, what is it causing disruption in the growth of teeth? What is the deal with that?
Yeah.
And I hope it's just younger patients that are sucking thumb.
Actually, no. There are some patients all the way up into early adulthood that continue that habit. And the reason why is it's a soothing mechanism, and it becomes a habit that is kind of addictive.
Right.
And it's very tough to break habits like that. So ideally, we want to stop thumb sucking by the time those permanent teeth start coming in. What I like to tell our patients is if you can tie your shoes, we should work on breaking that habit. But once those permanent teeth start erupting, we really want to get rid of any finger habits. And the reason is because thumb sucking actually does affect the growth of the jaws and the teeth. It can affect it so much so that a patient who normally would not have needed more severe interventions, such as jaw surgery, if that would need jaw surgery. So, for example, I had a patient who sucked their thumb all the way into their late 20s, and the only way to correct their bite at that time was jaw surgery. If we catch it early, if we catch it around the age of 7 or 7.5, we have appliances that we can use in our office, and we have very high success for stopping any thumb or finger habits with those appliances. And if there has been any growth issues, we can actually alter the growth and go back to a normal growth pattern, and it's very easy to do when we're growing. So ideally, we want to catch these patients when they are growing so that we can make those changes and help basically protect the growth and the development of the jaw so that they do grow normally.
She's Dr. Megan LeCornu, Embrace Your Smile Orthodontics, with 2 offices now in Santa Clarita. One, the OG office in Newhall, right off Wayman Court or Wayman Street, whatever it is, right across the street from OLPH.
Yeah.
And everyone knows where OLPH is. The new office in Valencia, right off of Smythe Drive, I believe it is.
Yep.
Right next to the ice station.
Yep, across the street from the high school, next to the ice station. It's a very convenient location.
I'm sure it is. EmbraceYourSmile.com. You can meet the team, go over all of their services. EmbraceYourSmile.com. You're talking about finger habits, and I remember you telling me one time that because I had the worst fingernail biting habits, and you're saying that can kind of chip teeth.
Oh yeah, that can absolutely chip teeth. So we really want to stop any fingernail biting, because once we get those permanent teeth, those teeth are our forever teeth, and over time the nails can cause small little microchips in the edges of the teeth, and that can continue to progress. And
I know, I think I have some of those.
Do
and
you?
Yeah. There's nothing to correct it though, right?
There are some things like there's some stuff you can get over the counter that you paint on the nails to make them taste bad. That can help. Oftentimes, if it's a girl, if you do like nail polish or if you get fake nails, that can really help.
Yeah, that's what my sister did. She also bit her nails. We're a family of nail biters, and she put the fake nails on, and then, a couple weeks later, she takes them off, and boom, you have your natural nails.
Yeah, a little harder for the guys.
Have you ever met right, exactly, a little harder to get away with. Have you ever met an orthodontist with messed up teeth?
Great question. I have seen an orthodontist with a few crooked teeth.
They
on
don't
the
want to get it
bottom.
fixed.
Well, I was always surprised by that. That was an older orthodontist, so maybe he felt he was going to be retiring soon, and or maybe he was going, getting ready to start some minor alignment. But honestly, most orthodontists, I think their teeth are fairly straight.
Right. And you had your braces at a pretty early age, right?
Yeah, I did. Well, I ended up visiting the orthodontist around 8 for an evaluation, and then I had my full set of braces when I was 12. And then I ended up as an adult doing a slight touch-up and retreated myself with Invisalign.
Ah, Invisalign. That's very popular these days. We've talked extensively about that in interviews previous, which you can catch on hometownstation.com. Obviously, braces can help cosmetically. You guys have all the science, all the research that backs up the notion that people are flawed, people are vain, and society is much more accepting of somebody with a nice smile.
Yes.
But health-wise, what are the health benefits of fixing your teeth with orthodontics?
I mean, obviously the cosmetic aspect is important because that's what gives people confidence to go to the world and, show the world their smile and what they're made of.
Hence, embrace your smile.
Exactly. But I think the health benefits are actually very, very important, and a lot of patients don't realize how critical those are. When our bite does not match up properly, we're more prone to chipping our teeth, damaging, wearing things out. We're more prone to TMJ problems. So there's a lot of negative side effects to not having the teeth line up properly. It can even affect the gum and the bone health. And so all these things start to add up. You can get periodontal problems. You can get gum disease because if there's severe crowding, it's very challenging to clean in between teeth. A lot of studies have shown that just 3 millimeters of crowding is a risk factor for periodontal disease.
Wow.
So
it's not a lot of leeway.
Yeah, so it's all these health things that are really important, and that's what helps us keep our teeth for our whole life, because nowadays we really should plan on having our teeth forever. There's no reason not to.
And people are living longer.
They are.
So you got to have the healthy teeth. She is Dr. Megan LeCornu of Embrace Your Smile Orthodontics, University of Denver alum, fellow Harvard alum, and of course, UNC Chapel Hill alum. Are all 3 degrees on display inside your office?
They are.
Which one gets the top billing? Which one is most prominently displayed?
Probably the Harvard one.
Yeah, of course.
Yeah.
I would flex on people like that
But
too.
the Harvard degree is in Latin, so most people
Is
don't
it?
know. Yeah, they don't print them in English.
That kind of makes sense. But Harvard is English, correct?
Yes.
It does say Harvard.
Yeah, it does say Harvard, and it says it on the frame, but the diploma itself is printed in Latin.
Awesome.
I called them to see if they could give me an English version, and they said no.
If they give you an English version, can I have the Latin one?
Yeah, right.
I'll just tape over my name or something. Dr. Megan LeCornu, Embrace Your Smile Orthodontics, Santa Clarita's go-to orthodontics office, rated and voted top orthodontist in Santa Clarita for at least the past 10 years. We are working on year number 11. You can meet the team, request a complimentary consultation, schedule an appointment, look over all of your treatment options, and more at embraceyoursmile.com. As always, Dr. Megan, thank you for coming in.
Thank you.